unmute myself. Okay. Live on Facebook. I love being able to work this all the way down here. This is nice.
That's just a normal mouse?
Yeah. Dude, I'm serious. You're gonna make me go over there and type it. Screw it. I'm gonna record. Okay, so this is going to go live in a second. Just wanted to give you that heads up. Hi, good evening. Welcome to JeffCo Health Matters, where we talk about health matters that matter to your health. We're a couple minutes late this evening, but we have a special guest today, which is Kate. She's our family nurse practitioner. She's finishing up with a patient, so obviously patient care comes first before Facebook Lives. So we're starting off this evening. My name is Brianne. I'm the communications specialist here at the Jefferson County Health Department. And tonight we're going to talk birth control, family planning, and a really cool program we have called the Right Time Initiative. So we're pretty excited about that. As I stated before, this is Kate. She's our family nurse practitioner. So Kate, do you want to just kind of introduce yourself? And
Sure.
Tell us a little bit about what you do here.
Yeah, so I'm Kate Wagner. I'm a nurse practitioner. I've been with the health department now for 12 years. And I love everything that we do in our family planning department. We are fortunate to be one of the federally funded clinics across the state. And our clinic has also been very fortunate to be funded for a special initiative called The Right Time that helps to sort of complement our family planning program, and it can help to provide birth control at low or no cost to patients. And that is just very exciting all the way around. So, yeah.
Kate's pretty awesome. We love Kate. She's good at what she does. So I guess let's just kind of jump right into one of our topics that we said that we were going to talk about, which was the Right Time Initiative. So you kind of mentioned that a little bit, but kind of give me the rundown on what that is without going too crazy in depth.
Yeah. So family planning patients can be male or female. And we basically, hit the range and age from like 13 to menopause for women, and male clients can be seen anywhere from 13 on up. There's no age cutoff. When it comes to the Right Time program, it's kind of a complementary program. So if you're already a family planning patient, the Right Time will be offered to you as well. So it's not something that you have to like apply for or anything like that. And when you come to the health department, like you don't have to come knowing for sure what it is you're getting yourself into. You just come saying like, here's a service that I think I might want, or, tell me a little bit about this. We'll handle all of the other excitement on the back end of things. We kind of know what we have, but just so that everybody is aware, we're trying to get rid of the barriers that we've had to care. One of the reasons folks a lot of times don't seek out birth control is the cost of things. They really maybe don't want to get pregnant, or it's not the right time for them to get pregnant.
I see what you did there.
Yeah,
the right time.
It's all about the language, but they also don't know how to afford stuff. They don't know how to afford their method. Maybe they have health insurance, but their insurance doesn't cover their method.
Right.
And they don't know how to make it work. And so they're just putting up with a method that they maybe don't love, but it's the least expensive one. So they're just kind of going with it. And so this program was really kind of pushed out by Missouri Foundation for Health, who partnered with the Missouri Family Health Council to help bring this program to Missouri women, and whatever method you're interested in.
Right.
We'll chat with you about the method. We offer all methods. We have them here in-house. We talk with you about your medical history. We'll talk with you about, the desires of your method. What it is that makes the most sense for you. Right. And then, we go from there.
Yeah. So I think you may have hit on this too, but one thing that I wanted to make sure we reiterate, what's the age qualification for the Right Time program?
Yeah. So basically, as long as you're a family planning, patient. So for a female over the age of 13, and, somebody who's, hopefully started having periods, and, do you have to be like a sexually active person? No, I mean, we can see you, regardless of, your sexual activity status. There's a lot of benefits to birth control than just like prevention of pregnancy. Yep. That's one of the biggies, but there's lots of other ones that are out there too. So
yeah. For sure. So we definitely, you mentioned that, down to age 13 and stuff. Some of the times we get a lot of questions either from youth or sometimes even from parents that say, hey, my kid is interested or my daughter wants to come in for birth control, or I want to come in for birth control, but I'm only 14. Do I have to have my parent with me? So can you kind of walk through that a little bit?
So it's always kind of like a touchy subject. I know that nobody really likes to tread there, but right. So it's a federal program. So it's not a local program. It's not a state program. It's a federally funded program. Because it's a federally funded program, there is no stipulation for parental consent that has to be, if you're under the age of 18, you have to come with a parent. No. So if you are over the age of 13, you can come and seek out services at the health department. Now, I will tell you, we encourage parental involvement, or we encourage the involvement of somebody over the age of 18. Yeah. So somebody who's over the age of 18, to make sure that you're getting the guidance and that you're not, that you're getting the advice and everything that you need as a teenager, right. Because life is tough, and under the age of 18, man, we sometimes just need somebody to walk with us right. through some of those kind of big decisions.
For sure. So we both know that this is a fantastic program, and you are more well-versed on the ins and outs than I am.
Sure.
But so if someone is curious, or they're like, hey, this sounds like a great program for me or such and such, or my daughter, kind of what do they expect? So they schedule an appointment, they get here, what do they do? What happens?
Yeah. So, I mean, I would always kind of expect to be here for, I don't know, between 30 minutes and 45. I mean, we try to not have you here for 2 days because nobody wants that. Most of the time, it's not a come in and be embarrassed, and get naked. It's not the days of coming in and sitting in a paper gown in a cold room, waiting for people to come talk at you is gone, I think. So we try to keep it, very sort of, focused on the patient. We are going to talk with them about, the reason why they're here, offer laboratory testing, whatever kind of STD testing might be, in patients interested in. The nurse will do most of their like medical history, gathering all of that information. I'm going to come in for a brief physical exam. There's only very few methods that would ever require us to do a pelvic exam. Mm-hmm. So I always tell most of our patients, if you're under the age of 21, you're most of the time not going to have to get undressed, at all. So keep your clothes on. Please don't take them off. So it's good. It's good. We try not to make it a terrible experience.
Right.
And then we chat with the patient about the method. So, if the patient knows which method they're interested in, that's the one we're going to chat with them the most about. There's only a handful of reasons why that method might not work for the patient, right. Specific health things that might, be a contraindication. But most of the time, the patients might have a generalized idea what they want, and then we're able to chat with them and then counsel them and then get them out the door with their method in hand.
Right. And one of the things that when we were kind of chatting and prepping for today's segment, you had said like one of the main questions that you kind of go into and the program really focuses around is, do you plan to achieve pregnancy or avoid pregnancy in the next year?
Sure.
Which I think is key, because you mentioned a little earlier too that though birth control main purpose that people think of is to control birth, or to prevent pregnancy, it's not always that. I mean, it can be like minimizing PMS symptoms, or
helping with cramps, helping with acne. So and some women are, they may want to sort of bridge their methods. So they may want to be on birth control for right now, but they may want to plan a pregnancy in 12 months or 18 months. So how do I go about doing that? How do I navigate that if I'm on birth control, or if I've been on a birth control method for so many months or years? How could I get off of this and, onto something for a while and then try to achieve a pregnancy? So we're all about trying to, plan families. So whether that means we're planning to avoid a pregnancy or planning to achieve a healthy pregnancy, we can absolutely have those conversations. So we'll counsel patients about prenatal vitamins and, how to go about looking towards, getting off of the birth control method that they're on and how they could, try to achieve a pregnancy. So absolutely, those are conversations we have in clinic every day.
For sure. Yeah. And I thought that was really important too, because even with my mom, that was kind of something that I did when I was younger. It was like, okay, we're looking into it for other reasons because, being a teen girl is hard enough.
It's hard.
When you have to go to PE
it's hard, right?
Super horrible cramps.
Right.
Sometimes there's other options.
Yeah.
So speaking of that, what are the options that we have? Because you mentioned earlier that we have methods on hand and you can walk out with them most of the time.
Yeah.
So what specifically do we have?
So we've always had pills. We've always had the shot. And I think that birth control pills and the shot are two methods that almost everybody kind of knows about. It seems like a lot of young girls, those are the kind of two most comfortable starter methods for a lot of patients. And with pills, same time every day. That's probably the hardest thing about birth control. Pills is at the same time every day.
Right.
I kind of look at birth control pills and there's two other methods that kind of go in that sort of camp, which is the patch, which is a patch that's like a little square patch that you can wear on your person. It gets changed every week. You typically get 3 patches per month, and then the last week of the month, no patch free. That's the week that you get your period. And then there's also a small ring, doesn't go on your finger, goes up inside the vagina. And that's the ring.
Disclaimer,
yes, very important. Doesn't go on your ear, doesn't go. Yeah. So, the ring is something that can be used, vaginally, and that goes in for 3 weeks and then goes out for a week. And so that, again, it's similar to the pill, and being able to give people a predictable cycle can really help with mood swings, menstrual cramps, hormonal acne, all of those benefits. The downside is you still get a monthly period. There are ways that we can kind of hop, skip, and jump over that. And patients seem to do really well with it. And we have all of those in-house. If you look towards the other sort of camp, we're looking at progesterone-only methods. Those methods are really good for folks who don't care as much about having a predictable monthly cycle. So if you're somebody who's like, I don't really want my period, or I could, take it or leave it, it's fine by me. The depot shot is once every 3 months. You can do something like the mini pill, which is just progesterone only, and it's something that can be taken still every day, but it doesn't have any estrogen. There is the rod that can go in the arm. So it's a small rod that goes in the upper inner arm. That lasts for 3 years. That one, some people get periods, some people don't. And then there are a whole host of different IUDs. We have one IUD here called the Liletta. That device actually lasts for 6 years. One device, 6 years, it's a magical deal. Yeah. So
that's not one that doesn't give you a period for 6 years.
So it could. Yeah. So it could. Yeah.
Good to know.
Yeah.
I learned something today.
Yeah, we do. Yeah. And then we do have like hormone-free options. So we have a Paraguard Iud, which is birth control for 10 years. It's a device that can last for 10 years. You still get a period with that one because there's no hormone in it. And then we always have methods like we have diaphragm that we can talk about. We have male condoms, female condoms, things like that. So definitely hormonal methods are probably the biggest pick for most of our patients.
Right.
I think the pills and the depot shot are probably our 2 biggest hormonal methods, but closely followed by the Nexplanon rod in the arm and the IUDs, I think, are big picks.
Right.
And when you look at what they cost out in, non-public health land, those devices are sometimes upwards of $1,000. So, they would be very cost prohibitive if you didn't have coverage to be able to try to afford one of those devices. So here, with the counseling, and if the patient's interested, we can provide that at low or no cost.
That's
amazing.
Awesome.
Yeah.
And then one thing I wanted to make sure we reiterate too, because when we were chatting, I was surprised to find out. So obviously if a patient chooses birth control pill, we have those on hand for the most part. And sometimes you said if our supply allows it, they can walk out with a couple months.
Oh, yeah. We'll try to give them, if the patient knows that they like the method, they've been doing well with it. I mean, we don't want to like, if the patient's like, I'm not really sure I like this,
True.
I'm going to try it for a couple of months. Okay, great. But if patient's been on their method for a long time, here's 13 packs and we'll get them out the door. So they don't have to mess with coming back to, get more supplies. So, we aren't a pharmacy, but we do try to give them the supplies on hand. When it comes to, the depot shot, they come here, they get their shot every 3 months, we move on down the road. And, if a patient signs up for a method that's 6 years and let's say, a year into it, they're like, not feeling this.
Good question.
It's not something that they've had to like, well, it's a 6-year method, you have to keep it. No, you don't like it. Let's come back. Let's talk. Let's, we'll have a counseling session, determine what it is about the method they don't like and figure out what method they want to switch to. Yeah. We will, pull the old device and then, get them started on a new method. It's all covered. Not something that they have to, hold on to their method for any length of time.
Yeah, we actually just posted something about that yesterday it was the day before on social media where it was like, don't fight your method, switch it. Like if you're not feeling happy. The one that you're on, like switch it up, come talk to Kate. She's awesome.
Yeah, like let's talk about it. Let's try to find one that's right for you. Don't use a method because all your friends are using it. Don't use a method that, maybe your mom and your grandma and your aunt you have used. Use a method that's right for you.
Right.
And ultimately, like it means looking at what is it that you're wanting out of it? Are you wanting a method to give you a predictable cycle so which week you want to, go camping or go, on a float trip?
That would have been helpful.
Yeah. If you're somebody who's like, I don't care about that, I just don't want to get pregnant. Then we look at so it's all in, what your motivation is. And so I think that's a totally different way of looking at things. And I think that's what's new and exciting for us is that, we don't have to look at it based on what can you afford? No, this takes that out of the conversation. You can afford anything because this is all going to be at lower no cost. So
yeah, that's awesome. So I'm going to switch over really quick. If I look like I'm staring at my screen, I'm switching over to see if we have any comments really quick. Because I can see. There we go. Okay, let's see here. Okay.
And we're always looking for new patients. I mean, I know
for sure.
If you've seen us in the past, you can come see us again. If you have health insurance, we do bill private health insurance. We bill we bill every Medicaid plan that's out there. We bill almost all private health insurance plans. And we have ways of working with your health insurance company. If they cover the method, great. If they don't cover the method, then the right time may be able to pick up, a portion of that bill so that it doesn't come back to you. Right. So we want this is trying to level the playing field when it comes to the methods.
For sure.
Yeah.
So if you guys have questions, go ahead and put them in the comments. I'm pulling them up on my phone down here, so I'm not just cruising Facebook. I mean, I am cruising Facebook, but it's for work. So we have one question here. It says, so you mentioned a no estrogen option. Mm-hmm. So does it have less side effects for someone who had negative reactions to Depo and bar?
In the bar.
Yeah.
Yeah. The
I know that is.
Yeah.
Okay.
So Depo and Nexplanon are both progesterone-only options. Neither of those have estrogen. So it just depends on what the reaction was, to those methods. Everybody has reasons why they like something and don't like something. So I think it's just more of a personal conversation that probably needs to happen between, whomever this is asking the question and their provider. I mean, again, what's the motivation for, getting the method and what kind of downsides did you have? I mean, some of those methods, contain a really high dose, and other methods are a lot less of a dose. But everybody's a little different. So I think we have to, it would be more of a personal conversation to have with your provider.
Okay, cool. So I'm going through and I'm thinking that my phone is hiding some of them. So I'm going to double check again on here and see if we are. Oops, sorry. There we go. Okay, so let's see. Okay, so far that looks like it's our only question that has come in, but they did say thank you, so you're welcome for answering that question. Let's see, what else did we kind of want to chat about here? Well, we kind of talked about the methods of birth control, what was popular, the right time, anything else with like family planning services that you want to hit on?
I think
we do a lot more than just birth control.
Yeah. So, I think the big thing about family planning is that, we've been here for a long time. We're not going anywhere. And I think ultimately, give us a call. We'll get you an appointment. I know the last year's been totally wild with COVID,
right.
But we're, definitely trying to get back on track with appointments. And so, feel free to give a call to our main number and we'll get you an appointment. We're going to be, starting our services up in Arnold next week. And so that's exciting for us to kind of get back to being both in Hillsborough and Arnold.
Right.
So yeah, just give a call and we'll get you an appointment and, try to, smooth things through.
Perfect. Well, it doesn't look like we're getting any other more comments that are coming through right now. Sometimes folks watch it later and have them. So
Sure.
If you have any other questions, you can leave them in the comments. I can grab those later. And if I don't know the answer, I'll find Kate and she'll give me the answer to them. So we're kind of actually getting close to hitting our segment time. So thank you for joining me again today. I'm very excited. We are continuing to do the JeffCo Health Matters segment every other Wednesday. It's live on Facebook at 6 p.m. But then we put it up on YouTube and Instagram TV afterward. Next week, we are actually going to be talking communicable disease. So not just COVID. We're trying to branch out a little bit, but we're actually going to be talking with our CD team, which is our Epi, Sarah, which most people are probably familiar with from her Stats with Sarah segment. But we have communicable disease nurses. They do investigations. We're going to be talking different types of communicable disease, their impact in the community, and kind of what the behind the scenes looks like outside of just COVID. So that one will be pretty interesting. If you have any other ideas for topics or programs that the health department has, or you're kind of more curious about, shoot us an email at communications@jeffcohealth.org. You can always message us, or you can leave some suggestions down in the comments below. We'd be happy to kind of investigate more and provide more information for you. Just like Kate said, one thing we want to make sure we hit on is we're always open to new patients. So if you're interested or you know someone who's interested in the family planning services, the right time, or anything like that, you can give us a call at our main number, which is 636-797-3737. You can reach out through socials and we can get you connected, or you can always send us an email at communications@jeffcohealth.org. So we're going to sign off for this evening. Thanks again for joining me, and we'll see you on June 16th for communicable disease. Thanks, guys. Have a good night.